sanitation issues are of paramount importance to the Tafo municipality. Yeah. So in this, that's why we brought up a campaign. We've collaborated with the Ministry of Sanitation and Water Resources to bring about the one toilet, one house campaign. Yeah.
Yeah, within Tafo.
Most of the household, they go to the public toilet, right? So when the Ministry of Sanitation and Water Resources brought up this project, we deemed it very necessary so that each house gets its toilet, right? So when each house gets a toilet, it will improve the sanitation in most of the houses, and then it will reduce or eradicate open defecation too. Yeah. So open defecation, we know all over Ghana, open defecation is one problem, and it is very, very important we eradicate it to prevent diseases. So basically this one household, one toilet project is helping to eradicate it. Yeah. Tafo Municipal to patronize this one household, one toilet so that we can eradicate, we will achieve our goal of open defecation free in Tafo Municipality. Yeah. Tell them disease have no boundary. We want to tell them to stop. We also encourage them to get bins and also use the bins. It's not about acquiring the bin. You have to use the bin. When you have rubbish, you put it in the bin so that we can achieve our aim of a clean environment in the municipality.
Your full name?
Linda Owusu, yeah.
And you are?
I am the Assistant Environmental Health Officer.
Thank you very much.
So basically, this sanitation cleanup is very important. It helps with the sanitation in the Tafo municipality, right? Yeah. We all know the benefits of cleanup exercises. It helps remove most of the dirt in our communities. And we know these rubbish and then debris, and then, yeah, they bring about a lot of sicknesses. So in these cleanup exercises, we help, is it Damak? Yeah, we are helping them, making sure that sanitation goes on very well in the municipality.
This exercise will go a long way, and it will benefit the hospital. As in Damak Health and Sanitation have come to the hospital to help us clean the hospital. Yeah. A lot of challenges. For example, recently we had a letter from the environmental agency in regards to our incinerator. The residents around went to report us that when we burn our waste, the smoke comes to their house and it's very harmful to their health. So they wrote to us to upgrade our incinerator. So we are on it. Management is working on it so that we solve that challenges. What do you call it? The clients who comes here, who comes for seek what do you call it? Healthcare. When they come in the morning, we used to educate them how to use our facilities. But it seems when they enter to the washrooms, they don't adhere to the rules and regulations that we give them each and every morning. So it's one of the biggest challenges to us.
And we know,
as I said earlier on, they cause or they give us plenty of problems. Sometimes they will drop or they will drop a waste on the floor, and when you confront him or her, the person will get angry. So each and every day in the morning, we used to educate them on how to use the various dustbins that have been labeled. We have what do you call it? General waste dustbins. We have what do you call it? Pharmaceutical dustbins and what have you. So the clients they are used to use the general waste dustbins.
Your full name and your position?
I'm Boate Kweku Ebenezer. I'm the head of environment. Boate Kweku Ebenezer, head of environment, Tafo Hospital.
for assembly. Anyway, thank you. Hello? Yeah. Morning.
Very much. Damak Sanitation Health Watch is a non-governmental organization, and our main purpose is to help educate the public on sanitation and health and its-related health issues. So we used to move to deprived community areas, especially to assist people who have no knowledge about the sanitation and its-related issues. But currently we realize that it has become a canker in our cities. Of late, whenever it rains, you could see flooding and other things. But we are using this opportunity to come and embark on this municipal, especially the Tafo Government Hospital. Since it is health plate, and at the same time we are embarking on the health and sanitation, we plan to come to this place to embark on this sanitation exercise so that we will be able to take this opportunity to educate the public on sanitation and its importance. That is why we are here today, and as you could see, we are made up of groups. We invited different groups, that is Friends of Dr. Kwaku Oten Society, Tafo Youth Homecoming Group, and that of media friends. And as a media group, always come with our friends to come and also assist us on such exercise. So that is why you've seen us this morning here in the Tafo Government Hospital. Looking at the recent, that was 2022 budget, they were proposed to have some, they allocated some fund for that. But we try to advocate and also urge the government that if that policy that they were planning to come out with, that tax, was it what 1% tax, sanitation tax, levy tax, yeah, we even came out with a release to support the government and appeal to Ghanaians to accept it, so that the government will utilize that tax money to help our sanitation sector. But one thing I want to, yes, I do say sanitation and water related issues are not only the government. And even if we say government, who is the government? It is you and I. So it is a collective responsibility for all of us to involve ourselves. Looking at our plans, we were able to help reach the communities that doesn't have water. I can mention few communities like Mpasaso, Nkwanta, Yamosi Room and other places. Through Damak Sanitation Health Watch, they've gotten water. And Damak Sanitation Health Watch to going to, as I was saying, some deprived communities whereby flooding always takes places there. We've embarked more exercises there, and now things are picking up. People are picking, and they are giving out their best to help the government. But what we want to call on the government to do more on sanitation is that the government shouldn't, the government should do his best to provide logistics, so that whenever each and everyone or a group of people want to do exercises, we can contact them and get such materials to embark on such exercise. But sometimes you go to the municipal or district and they don't have logistics. So how can we achieve the sanitation target which the government said within a period of time he wants to have the nation one cleaning, a clean city in Africa. Yeah, so I'm very sorry, but to achieve this, the government needs to double up his plans and make sure that whatever he says, he works toward it too as well.
Yeah, lastly, you talk about
Yes, I do say sanitation and water related issues are not only the government. And even if we say government, who is the government? It is you and I. So it is a collective responsibility for all of us to involve ourselves. Looking at our plans, we were able to help reach the communities that doesn't have water. I can mention few communities like Mpasaso, Nkwanta, Yamusi, Krum, and other places. Through Damak Sanitation Health, they've gotten water. And Damak Sanitation Health